Andrew is a 45-year-old gentleman who was referred to the heart failure nursing service 5-6 months ago now. He has dilated cardiomyopathy and that affects him quite significantly. He experiences shortness of breath on slight exertion, dizziness, palpitations, and he was referred to the service for support, for education and also for the titration of his medication. So he needed to try and get his symptoms under better control. He's a gentleman who moved from New Zealand earlier this year and lives with his partner and her young daughter.
I picked up a waterborne viral infection that got into my system and severely damaged my heart, which has left me with symptoms of my heart is continuously racing a lot faster than it should do most days, and it leaves me feeling very dizzy, very lightheaded and also very, very weak.
We chose to offer telehealth to Andrew for 3 reasons. Firstly, Andrew acknowledged that he felt really quite anxious regarding his condition, and we felt that it may offer him some reassurance, and indeed that's what we found. It has been reassuring to Andrew. Secondly, we were making quite a lot of changes, or quite a lot of changes were proposed to his treatment. And it meant that, for example, when we were increasing beta blockers, we would be able to keep an eye on his heart rate and his blood pressure response. And the same when we were increasing ACE inhibitors, so it would be potentially very helpful in those circumstances. And finally, it was also felt that telehealth would be helpful in teaching Andrew to monitor his own signs and symptoms and watch for signs of fluid retention, for example, by weighing himself daily and beginning to recognise that perhaps an increase in weight would mean that he's retaining fluid. So there was also a patient education element too about symptom recognition.
I know if I'm not having a good day, I can do a test and the information gets sent through to somebody and they are generally in touch with me quite quickly, which is very, very reassuring to me.
The benefits of telehealth for Andrew have been that he appears to have taken responsibility and ownership of his condition a little better than he had in the past. Andrew readily acknowledges that he would leave symptoms until he was actually very poorly before accessing help, whereas with telehealth, it's a prompt, it's a reminder that he is perhaps becoming more poorly, and also it's alerting us if signs and symptoms are changing, so we're quickly in contact. I think that's being very helpful.
My partner has been wonderful. She is like me, and in a lot of ways we don't really understand the terminology that all of the doctors and heart failure nurses use. But she does worry about me, and it's sort of very reassuring for her when she's not here. If she's out at work or something and I'm here alone, she knows that if I was to have a bad turn or having a particularly bad day, that I just have to do my test and that somebody will be in touch with me, and if I'm in a real bad way, they will probably get in touch with her as well. So it's a very reassuring feeling having the telehealth care here for myself and also my partner.
The main role for telehealth is to help patients monitor their conditions, understand their conditions, and thereby helps them to stay well and ultimately at home. People often wonder whether it means an awful lot of work to use telehealth. The simple answer is it doesn't. It was initially an introduction course which was 2-3 hours. Our practice nurse and I went to it, and we really quickly got to grips with the system. I get informed by the company whenever the data become abnormal, but other than that I don't have to do anything else with it. And very occasionally, of course, yeah, an alarm means a visit, but I probably would have had to visit the patient anyway if I had waited long enough, because they would have become so poorly that they needed a visit. We live in a very rural area here, and for us in North Yorkshire, telehealth is actually an ideal tool to monitor patients live in remote villages and farmhouses, and it's often very difficult, especially in the winter, to get to see them. So to know that they're okay is very reassuring, even if I can't get to see them.